is the RefluxRaft formulation, is there like a recommended way to take it? Like as far as like when to take it, around meals or how many times a day to take it? Or does it just depend?
It depends on whether or not we're using it to treat overt heartburn symptoms, in which case it can be taken at the time of symptoms. In general, though, for a lot of LPR type issues, the recommendation is after meals and at bedtime. And so 15 to 20 minutes after the meal to allow the food to settle and intermix with the stomach enzymes and the acid, and then take the product after that. And it can be anywhere from 1 to 3 teaspoons of the product, which is pretty similar to other products on the market. And then the big question we get is, well, can you eat and drink after you've taken it? And, in essence, if you eat, you are disturbing the raft. And if you're eating continuously, that's also probably not great for reflux because your stomach never empties. In essence, we do try to recommend against eating. But if you're drinking water, it will temporarily displace the raft, but then the raft will float back up because it remains that carbon dioxide in it, so it'll float back again. And then over 3 to 4 hours, the body gradually breaks the raft down and it moves through the GI tract and excreted. But so after meals and at bedtime, so 4 times a day, potentially, that has to be decided in concert with the healthcare provider and the patient and the symptoms they're having and what specifically you're trying to treat with that product.
Yeah. And because it's kind of just working in the stomach and not really being absorbed, I would assume that means there's much less problems with like interference with other medications or things like that.
Yeah, there's no real cross-reactivity. And then, like I said, the issue with the licorice root is non-existent. There is some issue, apparently, according to some studies, with ginger and some of the transplant-based medications. So like tacrolimus, there's like one study out there that indicated maybe an issue in rats where it was studied. So I would say that. So I would say there's no interactivity, but that's the only one I've heard of.
Any contraindications? Are there any patients that you would say absolutely cannot take this?
No, I mean, it's alginate-based products have been shown to be safe in children and in pregnant women. We've tried it on lots of the pregnant residents and or spouses of residents who have said it's the only thing that had finally relieved their 3rd trimester heartburn and indigestion. So it's really a safe product for everyone. It's kind of actually amazing that more people don't know about it once you realize like how good it can be for treating these things.
And safe to use kind of indefinitely as much as you need to.
Right. The only issue could be, and for our product, I mean, you've got to put some sort of a preservative in all of these items that are going to be on the shelf so that they can be shelf stable. And so there's any variety of things. And, because I'd done the functional medicine training, I really wanted to make sure that there wasn't anything in our product which was going to be problematic in that regard, which becomes really tough because there's something about everything out there. And so we ended up using an all-vegan, non-soy, non-corn-based glycerin as our preservative. So the biggest issue with that is that for some people it can be, loosening the stool, but we have yet to hear a complaint from anybody about that.